Welcome to Health Diagnosis. Today, we're talking about a topic that affects millions of women around the world: uterine fibroids. These are non-cancerous growths that develop in or on the uterus. They can cause symptoms like heavy menstrual bleeding, pelvic pain, frequent urination, or sometimes no symptoms at all. Many women immediately think surgery is the only option, but that's not true. There are several effective, non-surgical treatments that can help shrink fibroids, relieve symptoms, and improve quality of life. Let's go step by step and talk about what these options are, how they work, and who they're best for. First, let's understand a little more about fibroids. They're influenced by hormones, mainly estrogen and progesterone. That's why they often grow during the reproductive years and may shrink after menopause when hormone levels drop. Knowing this helps us see why some treatments aim to balance hormones rather than remove fibroids directly. One of the most common non-surgical options is medication therapy. These include hormone-regulating drugs like GnRH agonists, which temporarily lower estrogen and progesterone levels. This can shrink fibroids and reduce heavy bleeding. However, they're usually used short-term because they can cause menopause-like side effects such as hot flashes or bone loss. Sometimes doctors prescribe them before planned surgery to make fibroids smaller, but they can also be used alone if surgery isn't an option. Another type of medication includes hormonal birth control pills, patches, or intrauterine devices, often called IUDs. These don't remove fibroids, but they can control heavy bleeding and menstrual cramps. The hormonal IUD, especially the one that releases levonorgestrel, can be very effective for women who mainly struggle with heavy bleeding rather than large fibroid size. There are also newer drugs called selective progesterone receptor modulators. These medicines, like ulipristal acetate in some countries, help reduce bleeding and can shrink fibroids to a certain extent without causing the strong side effects that come with estrogen suppression. Apart from medications, there's a highly effective, non-surgical procedure known as uterine fibroid embolization, or UF. This is performed by an interventional radiologist rather than a surgeon. It involves inserting a tiny catheter through the groin or wrist and guiding it to the arteries that supply blood to the fibroids. Tiny particles are then injected to block the blood flow, causing the fibroids to shrink over time. What's great about this treatment is that it doesn't involve cutting or removing the uterus. Most women go home the same day or the next day, and recovery is much quicker than surgery. Studies show that UF can reduce symptoms like heavy bleeding, pressure, and pain in over 80% of cases. Another advanced, non-invasive technique is MRI-guided focused ultrasound. In this method, sound waves are used to heat and destroy fibroid tissue while guided by an MRI machine. It's completely incision-free and doesn't require hospitalization. However, it may not be suitable for all types of fibroids, depending on their size and location. Lifestyle changes also play a big role in managing fibroids naturally. A healthy diet rich in fruits, vegetables, whole grains, and fiber helps balance hormones. Some studies suggest that reducing red meat and increasing green vegetables and vitamin D intake may lower fibroid risk. Maintaining a healthy weight is important too, since excess body fat can raise estrogen levels, which may contribute to fibroid growth. Herbal and natural remedies are another area many women explore. While research is still limited, some herbs like green tea extract, milk thistle, and vitex, also known as chasteberry, have shown potential to support hormonal balance and reduce inflammation. However, it's essential to consult a healthcare provider before starting any herbal supplement, especially if you're already on medication or have other conditions. Managing stress is also key. Chronic stress affects the body's hormone balance and can indirectly worsen fibroid symptoms. Yoga, meditation, and regular exercise not only help relieve stress but also improve circulation and overall hormonal health. It's also important to keep track of fibroid symptoms over time. Regular checkups and ultrasounds help monitor whether they're growing or shrinking. For some women, fibroids remain stable and don't cause any problems, so treatment may not even be necessary. Just observation. If symptoms are mild, focusing on natural management through diet, exercise, and hormone balance may be enough. But if symptoms become severe, such as heavy bleeding that causes anemia, pain that disrupts daily life, or rapid fibroid growth, then medical treatments like embolization or medication might be the next step. The good news is that technology and research are constantly improving. Non-surgical treatments are becoming safer, more effective, and more personalized. Every woman's body and situation are different, so it's crucial to discuss all options with a qualified gynecologist or interventional radiologist who can tailor a plan for you. Uterine fibroids can be frustrating, but they don't have to control your life. Whether through medication, embolization, focused ultrasound, or lifestyle changes, there are many ways to manage them without surgery. Thank you for watching Health Diagnosis. If you found this information helpful, don't forget to like, share, and subscribe for more reliable health insights. Your support helps us continue to bring clear, evidence-based information to help you make informed choices about your health.